Hey guys, this is Dr. Sean over at Fortis, and we are doing week 6, part 4? I think, yes, part 4. You can see it at the top of the page. I'll scroll up, actually, right there we go. Scrolling up there is part 4. Man, where are you, man? Come on. There we go, part 4 right up there. And we're going over some more of the breast and lactation, drag the words kind of thing. We have the words over on the side. I've done the other 3 parts already, and so you can go look those up also. Don't forget that you can do these again and again and again to get the right score, right? We want to increase our scores, especially at the end of the term like this, because Friday night, everything is due. And if it's not done, then we're messed up, okay? Hopefully you guys are hearing all this, and hopefully you can see me over here and everything is up there. But we're going to go through the circular area, hopefully circular, sometimes kind of oval, of pigmented skin that surrounds the nipple is called the areola. Oddly enough, there are a lot of glands there. There's some glands around that also help the baby find it. You have what's called the rooting reflex, which if you take a little baby and you go like this, they go, ah, over there. You go like this, they go, ah, over there like that, right? So you scratch the cheek or touch the cheek and they'll start moving towards it. That's actually a reflex that little babies have. That's how you tell if babies are very healthy. You can give them that little reflex and they'll move towards that side. It's also fun to do little kids, just back and forth and back and forth. This muscle is located deep in the breast. No, deep to the breasts, right? So deep to the breast is the pectoralis major. That's this muscle here. Both males and females do have that one. It's your bench press muscle. Okay, you build that up, and you actually will have more lift in those kind of areas. Other name for milk production is this is a dumb one. Milk. So it's going to be milk. Where's milk? Where's milk? Milk letdown. Here's so once baby is born, there's a release of pitocin and oxytocin and all this kind of stuff, and that helps with the milk reflex, right? Milk letdown reflex. And once baby suckles and actually does something to the nipple, that sends information to the brain, and the mom goes, "Hey, baby's alive, baby's eating, release a lot of oxytocin," and then baby goes like, "Oh, I love my mommy," and mommy goes, "I love the baby," and then that's how things work. It's a lot more chemistry than you think, right? Reflective response to the reflexive response to the suckling of an infant at the breast. Oh, that's funny. Alveolar glands. Oh, reflexive. What? Name of the milk. Oh, the milk letdown. Oh shoot, we have a mixed one. Milk letdown is here, and lactation. Sorry about that. Another name for milk production. Lactose, right? Lactose. Like lactose intolerant people have a bad problem with milk. Sorry about that. I was wrong. Milk secreting glands. Those are the alveolar glands that's inside the breast tissue, and they're like little fingerlets inside there, and then inside the breast, and they grow like crazy once you start that milk letdown reflex and lactation, right? If you don't do lactation, the body assumes that the baby's not there and just starts to dry up. That can happen within a few days. Yellowish watery fluid rich in protein and antibodies secreted by the mammary glands on the first for the 2 to 3 days after delivery. This is called colostrum. Very important. Now, weird part about this, if any of you become like midwives or doulas or stuff like that, you're going to learn a lot about lactation. And lactation changes as the baby develops. Also changes depending on what the baby needs. Because the baby, as it suckles, there's a really wild communication between mother and child with that whole thing, and to keep baby more healthy, right? Another name of prolactin, the hormone that is dependent on the hypothalamic release of lactogenic hormone. Lacto, again, lactose means, come on, man, milk, and genic means generate or to make. That's what it means. So it kind of gives you a hint on that one. We probably could have got that one. Gland that secretes prolactin is the anterior pituitary gland. Prolactin promotes lactation. Right? The gland that secretes oxytocin. We talked about that's I love you chemical. Here's a weird thing about that one. The where'd it go? Neurohypophysis. The weird thing about oxytocin. Here we go. Oh, it's just suckling by the infant on the breast stimulates secretion of this hormone, also known as the myometrial connection, a contraction, right? The hormone most associated with the milk letdown. Okay, not only as soon as that happens, the breast starts to make way more milk. That's the milk letdown reflex. Two, it also helps contract and get the uterus and everybody to come back where it was and let go of that placenta and stuff like that. It also is involved in that whole thing. But wait, there's more. It is also called the I love you chemical. And oxytocin, if released in sufficient enough amounts, even in a person like I release oxytocin. Everybody releases oxytocin. My dog goes crazy releasing oxytocin as soon as it sees me because it loves me, I hope. And I release that when I see the dog, so it makes us bond closer. Now, if you release a lot of it, you will start to see that everyone looks familiar. So what happens if people decrease their oxytocin? Everybody starts looking strange. One of the main things and the problems we have with these days with people is that they're not enough human interaction. 20-second hug releases oxytocin, so go hug somebody and release that and be nice. Milk is secreted into these ducts within the breast. That's going to be the lacticiferous ducts. And then these are connective tissue that helps support the breast. Suspensory ligaments. Now, one of the suspensory ligaments, come on, man. There we go. Let's check them. We got them all right. Anyway, again, another 6.5 minutes. Jeez, too long. I don't know why my hands are itching. Maybe I'll get some money. Hope you guys are doing well. This is part 4 of 9. I might stop it there. I might continue on with these, but I'll post these ones today. And hopefully you guys are doing well. Don't forget, everything is due by Friday, right? Friday night, or something like that. Saturday morning. Friday night, I think it is. And then I'll be doing the grades right after that. So if you're having a problem with anything, let me know in the email or something, and I will get back to you as soon as I can. Talk to you later. Take care, and goodbye. See you on the flip side.